let's talk about vulvar hematomas. I wanted to do some research because I just recently had a patient with one and they're not super common. So I just wanted to know more about them for my sake, but then also to educate other people if you're gonna have a baby. So what it is a pocket or area in this general vicinity that fills up with blood. And again, like I said, not very common. And it's typically in response to, like this says, a vascular injury. In the case of my patient, she just had a tear, but it could happen if you have an episiotomy as well. And I want to point out it's very common if you've pushed for any length of time, but especially if you pushed for a long time, to have a certain amount of swelling in your labia or vulva. But with a hematoma, typically it's one-sided, like where the damage was. Also, I thought it was interesting that most spontaneous hematomas were right-sided. So what are we gonna do about them? So we're gonna be big on pushing ice packs, keep rotating them out, some local compression to that area, trying to rest, and pain medication. So ibuprofen, or if you need a roxicodone. Probably gonna be checking your hemoglobin and hematocrit, just make sure you're not like losing a lot of blood. Keep in mind if it's severe, then surgical intervention might be required. This is why it's so important to tell your nursing staff if you notice any changes, sudden uncomfortable pain, gushing of blood. Don't get brushed off and make sure that they actually assess you down there.